Now, in the second part of our this discussion regarding the abdomen, we are going to focus here in another part that is called the abdominal cavity. After we have removed the almost 9 layers of the anterior abdominal wall. Out of this, the three were in the previous sessions. You have seen that the three are skin and the fascia. This is called the skin, fatty layer of the superficial fascia, and the membranous layer. Then the three layers of the muscles, external oblique, internal oblique, and the deepest will be the transverse abdominis muscle, and then three layers of the connective tissue are the epithelium, that is the fascia transversalis, extraperitoneal fat, and the parietal peritoneum. 9 layers we have removed here to enter into the peritoneal cavity, where the peritoneal fluid, in fact, will splash out here. You see, we are opening the abdomen here, that is called the laparotomy also. In the midline, we are actually having here a median um, incision here, the long median incision longitudinal, where you will open the abdomen here. See this diagram. In this diagram, you have opened it. Open the anterior abdominal wall. See in this transverse section of them. In the transverse section, what you have removed here to show you this. Now see this one layer that you have removed here, the skin. And in another layer, you have removed here the superficial fascia, fatty layer. Then the membranous layer, blue color. You are watching in the central region, these are the rectus abdominis muscle, you have removed this. These three muscles, you see the three layers you have removed. And now these are the three deepest layers. You will see this is called the fascia transversalis, remove this. And then extraperitoneal fat, remove it also. And then the parietal peritoneum. When you are removing the parietal peritoneum here, means you are opening the book like here. This is opening. And opening here, you are seeing this. This is called the gastrointestinal tract, any part here. This is called here, okay, small intestine. You are watching here the small intestine. You see all the small intestine uh, loops or the coils you are actually seeing in the middle. This is small intestine starting here from the jejunum. You see starting from the duodenum, jejunum, and ileum. But you see it's arranged in the center, it is okay. But when you have removed all these 9 layers, skin and fascia, then the three muscles, and then the three layers of the fascia transversalis, extraperitoneal fat, and the parietal peritoneum, if you're removing them and the peritoneal fluid is actually has been removed or recovered here, you are watching here. When you will actually see, you can't see this, the small intestine in the middle. You will see, in fact, here, like a blanket here, there will be a fat embedded within the peritoneum, embedded within the greater omentum. You will see actually, you can't see these coils of the intestines. In fact, after removing these 9 layers, you can't see them because all they will be hidden by this blanket of greater omentum. If you want to see them, your greater omentum has to be reflected up here. Do you see this? It was like a blanket here. We have reflected here. This is called the greater omentum. This greater omentum, this is a double layer of peritoneum. That we will discuss later. But you see, this is a peritoneum. We call them greater omentum. And greater omentum is in fact covering the central part of your abdominal cavity, where suspended are these coils of jejunum and ileum here. You see these all coils of jejunum and ileum in the center. And when the ileum actually finishes here at the right iliac fossa, large intestine starts. And the large intestine starts here. So you see, these are called the jejunum, and this is called here the ileum. You can say some 20 feet long small intestine here, and 1 foot will be duodenum also. 21 feet long intestine, small intestine, starting here from. But before that, we have the stomach and a part of the esophagus also. The stomach and a part of esophagus, just half an inch of the esophagus. Infradiaphragmatic portion here, abdominal part of the esophagus. And at the same time, we have got here under the diaphragm, liver also. At the same time, biliary duct, gallbladder, and all these things we actually will see, including even the spleen as well. So in the peritoneal cavity, in the abdominal cavity, these things we will actually have to watch here. So what you have to see in these structures, I told you that first thing will be esophagus, then stomach, In sequence, we will go like in duodenum, jejunum, ileum. These three are called small intestine. But at the same time, we have got here, you see, this is called cecum. Suspended or attached to the cecum is appendix. And cecum becomes continuous with the colon. And colon means you call it ascending colon. Then this is called a transverse colon. This will be the descending colon. And that will dip into the pelvis. You call it the pelvic colon, or you can call it the sigmoid colon. Sigmoid colon will be part of the pelvis. We'll not discuss in the abdomen. So all these four parts plus cecum and appendix, 6 parts, and sigmoid colon that will become continuous with the rectum. That will be also the pelvic structure. And then the anal canal, that will be the perineal structure. All these together, because some part of the GIT we will discuss in the pelvis and the perineum. But these structures we will discuss here. But not only this, but the glands connected to that. That is called biliary system and the liver also. Means along with them, you see, you have to discuss here one thing that is called the pancreas. And another is the liver. Connecting both is the biliary system. And along with that, don't forget one more thing is the spleen. These structures we will discuss in abdomen. And we have actually seen here in the abdominal cavity. It's a longer part. And when you discuss all these things, then you will discuss here the neurovascular bundles. Neurovascular bundles means the arteries, veins, and the nerves and the lymphatics together. Together means when you are discussing here the esophagus or stomach, don't actually mention its blood supply, venous drainage, lymphatics, etc. of the stomach only. First of all, see the anatomy of these things and the clinical relevance or the clinical important facts about these structures in sequence. See the anatomy first, and then the blood supply of all the structures together. Because all the blood is in fact is coming from the retroperitoneal structure, that is called here the aorta, and this is giving long blood vessels here straight into the various parts of the gastrointestinal tract. But here you are watching the abdominal cavity, and these structures are present here. And if you see these structures, your anterior abdominal wall almost is having an identical configuration like in the posterior abdominal wall is. But if you are removing all this, for example, if you remove all this colon, etc., all these things you are removing. Now see this remove. Means what you have removed last, you have removed here, last thing is the parietal peritoneum. Means if you remove the last thing is the parietal peritoneum, where you have entered into the extraperitoneal fate. Have you entered into the extraperitoneal fate? Means in the extraperitoneal fate is suspended and embedded here the extraperitoneal structures, because it is extraperitoneal, behind the parietal peritoneum obviously, related to the body wall. But this area, extraperitoneal area, will be present laterally as well as interiorly. So this is actually present interiorly and laterally both. But on the posterior side, the extraperitoneal fate is abundant. It's too much here because a lot of structures in the posterior side is in fact are suspended here in the extraperitoneal fate. So here we call it the retroperitoneal fate. I say call it the retroperitoneum. So this compartment is very important because it is giving shelter here to the pair of kidneys, great vessels, and all these things here, suprarenal glands and many other structures. So these are in fact present here. So when you will actually be cutting all these anterior abdominal wall and removed all your peritoneal, I say abdominal structures, all of them, if you remove them, you will reach the posterior abdominal wall. And where you have entered? You have entered into the retroperitoneum. So you will come across the retroperitoneal viscera. And when you remove these retroperitoneal viscera, you will come to the posterior abdominal wall from inside. And from inside, what you will see? From inside, what you have removed first? You have removed from here three, you say, one structure that is called the parietal peritoneum. Then second structure will be your extraperitoneal fate. Then third structure will be your fascia transversalis, which on the back side will not be called as the fascia transversalis because back side we don't have transverse abdominis muscle. Here its name will become sos fascia. Fascia covering quadratus lumborum, like high. So if this is actually present, so three structures are there, and then on the posterior abdominal wall also we have got 3 layers of the muscles, which we will actually be seeing them later. But you see all this here. So removing all this anterior abdominal, say peritoneal or the abdominal structures, you will go to the posterior abdominal wall. And we go to the posterior abdominal walls. First, you will come across the posterior abdominal wall viscera. And when you remove them, for example, in the middle aorta, and the right side will be the inferior vena cava, giving their branches all over, and the two sides will be the two kidneys. On the top of the two kidneys will be the suprarenal glands. And if you remove them all, then you will be having here a totally clean posterior abdominal wall from inside. Inside means how many layers of muscle? 3 layers. Which muscle you will feel from inside? It will be the third layer, obviously, because you are going from inside. Remove the third layer, the second, the first. And after first 3 layers of the skin and superficial fascia will come. And you will see that in the next session when we will actually change this diagram.